Okay, good morning. Welcome to this workshop hosted by the European Commission. It's a workshop on research and innovation on pandemic preparedness at the EU and global context. So if you're in the wrong workshop, it's not too late to leave, but you might not get seats in another place. So welcome to everybody who is here in person and welcome to everybody who is here online. My name is Kasia Jurczak. I'm heading the unit Combating Diseases at the European Commission's DG Research and Innovation. And it will be my pleasure to moderate that panel. I have to say it feels a bit weird because we have one panel here, part of the panel, the other panel here. So I feel like in my favorite TV show, University Challenge, and I can channel my inner Jeremy Paxman. So what I'll do, I'll definitely stick to timekeeping. I'll draw on that inspiration. So for my dear presenters, I'll be giving you a sign in case we go a little bit over time. And I will try that we wrap up that initial about hour of presentations to give you the floor also to be able to ask questions and interact with our panel members. So investment in research and innovation is key to make us better prepared for epidemics and pandemics. And a lot has happened, of course, since COVID-19, but a lot has been happening or had been happening before that pandemics. And for us, it will be an opportunity to map today the different initiatives from a global level, regional, bi-regional, and also zooming in here at the EU and national level. With us online, we have Anna Maria Heneo Restrepo from the World Health Organization. Hello, Anna Maria. I know you're online. I cannot see you, but we'll see you later when we introduce you to the floor. And here in the room, we have Shingai Machingaidze, all the way from Cape Town. She joins us from the International Pandemic Preparedness Secretariat. She's the co-chair of the 100 Days Mission Science and Technology Expert Group. Next to her, all the way from Brussels, we have Michael Makanga, the Executive Director of the Global Health EDCTP3 joint undertaking, and he'll tell you what that acronym means. But probably you all know it and love it. On the right-hand side, we have Hervé Raoul from Paris. He's the Deputy Director of the French National Agency for Research on AIDS and Emerging Infectious Diseases. And very locally from Berlin, Christian Drosten from the Charité, where he's the Director of Institute of Virology. Welcome, everybody. Okay. Exactly. So as I said, in the first session, we will be piecing a puzzle, going from global to African, European, national picture. And I would like to ask our presenters, starting with Shingai, to introduce how your initiative supports research and innovation in epidemic and pandemic preparedness, and building into it how they align with each other, okay? So to help us understand how those different initiatives are related.
Thanks very much, Kasia, and good morning to you all here and online as well. So I'm hoping everyone in this room has heard about the 100-day mission. Can I see a quick show of hands? Not such a good start, but I'm hoping in 3 minutes I'll be able to tell you all about what the 100-day mission is. So the 100-day mission is an international effort that's working towards making safe, effective, and affordable diagnostics, therapeutics, vaccines available worldwide within 100 days from when a public health emergency of international concern has been declared. It's enabled by strengthening global surveillance, improvements to clinical trials and regulatory processes, regionalized DTV manufacturing, sustainable financing and procurement, and rigorous health governance. And the International Pandemic Preparedness Secretariat is the independent body that was set up. It's a time-limited entity that supports the delivery of the 100-day mission by keeping pandemic preparedness high on the political agenda, by catalyzing scientific exchange, by facilitating multidisciplinary engagement, and producing annual implementation reports that independently assess the world's progress towards meeting the 100-day goal. So there are 3 goals: to fill the R&D gaps in diagnostic therapeutics and vaccines, to work on pre-agreeing rules to govern the pandemic response, and to embed best practice in between pandemics. So while we talk about the first 100 days of the pandemic, it's important for us to know that it starts before the 100 days. Just because a public health emergency has been declared today doesn't mean that the outbreak had not started earlier. So it's important to be able to understand that these 100 days that we talk about are preceded by several hundred, several thousand days of work, of research, of collaboration, which you all do. And of course, beyond the 100 days, there is a lot more that must happen. But within that 100 days, we would like to see, once a declaration has been made by the WHO, and most recently with Mpox, we've seen a continental declaration of emergency of continental security, to facilitate financing available for research and response, to bring together the public and the private, to initiate the R&D, to identify the gaps, address the target pathogen using programmable platforms that, of course, have had previous work and investment done in them, and to initiate international, regional, and national clinical trial networks to be able to test the possible drugs, vaccines, and therapeutics. And the goal is to have an accurate and approved rapid diagnostic test, an initial regimen of therapeutics, and vaccines ready to be produced at scale. So in short, that's the 100-day mission. We produce what we call our implementation report. We are working on producing the 4th assessment, which will be launched in January 2025. I encourage you to have a look, scan the QR code, and you'll be able to find out more details. And lastly, in my next question, I will make reference to this scorecard, and you can also scan this so that when I talk about that in my next question, you'll know what I'm saying. I hope I've stuck to 3 minutes.
Perfect. Perfect. Thank you so much. Over to you, Michael, please. And Michael also has a couple of slides and 3 minutes to present his initiative and how it links to the other ones. Could we ask for technical assistance?
Yeah. Sorry, there was disjointed.
Okay.
Good morning, ladies and gentlemen. Briefly, I'll talk you through disease preparedness, epidemics, and pandemics research preparedness and response, giving you the Global Health EDCTP3 perspective. We are an EU-funded partnership currently involving institutions mandated by governments of 15 European and 29 African countries, which make the EDCTP Association on one hand and the European Commission on the other hand. And we contribute to the implementation of the EU Global Health Strategy and the AU-EU Innovation Agenda. Focuses of our work is on major infectious disease threats facing sub-Saharan Africa, and we tackle all stages of clinical evaluation, particularly late-stage studies with a special focus on vulnerable populations. We are very intentional when it comes to strengthening and building research capacity in sub-Saharan Africa. With a focus on clinical research, we build the requisite capacity for clinical trials, addressing the various infectious diseases, not forgetting the emerging and re-emerging infections, and paying attention to the overarching areas of antimicrobial resistance, climate crisis-related infectious diseases, and of course, the digital evolution. We thrive on action, pivoting the clinical trials on the various infectious diseases. We very quickly, for example, have activated the Mpox response to respond to this outbreak. And thanks to the funding from the European Commission and funding from the member states, we've been able, within a space of 4 months, to have 4 consortia that are already starting work, addressing different areas on surveillance, diagnostic evaluation, major on vaccines, and also aspects of therapeutics. And this is addressing various populations, the general population, pregnant women, newborn, and children, as you can see. And more importantly, this is addressing the cross-border interactions with involvement of 9 countries in sub-Saharan Africa and good international cooperation involving the European Union member countries, Canada, and the United States. And I'll say more after that. Thank you.
Thank you so much, Michael. Okay. So the speakers are very disciplined. Thank you so much. So we went from the global initiative to regional, bi-regional. So because the European and developing countries clinical partnership, as the name would suggest, covers the two continents. And let me now introduce the next speaker, who will bring us our focus on Europe. Hervé, the floor is yours. You can come here. You can speak from your seat, whatever you feel more comfortable. This was really for helping us with the slide deck.
So thanks a lot, Cassia. I will stay here.
Perfect.
Yeah.
We can wave to each other.
I hope so. Yeah, no, thanks a lot, and for giving me the opportunity to talk about a European initiative clearly dedicated to pandemic preparedness. It is at least three-step initiatives, because the objective of this initiative is to build the future pandemic preparedness partnership at the European level. And till 2 years now, it has been funded through a coordinated and support action funded by the Commission. And then that, of course, the objective is to prepare the future partnership itself. So during these years, of course, we had to work on something that is very important to decide exactly what will be the governance of this kind of partnership, because it's something that is not so obvious, and also, of course, to define the activities that will be performed. But probably the main activities we had to perform was to define what would be the strategic research and innovation agenda. It is something of main importance, because if you want to perform preparedness and develop preparedness partnership in the future, you need to clearly say what will be the scientific priorities that you will have to support. So this has been done. And now, of course, another aspect is to ensure that there is a close link and articulation with the other initiatives at the EU level, but also at the more global level. So it is something we are already done. And now we are moving to a proposal for what will be the future partnership in the future. So it is something that will be submitted by end of fall this year. And that will be articulated around 4 main pillars. The first one, of course, will be to maintain at the right level the strategic research and innovation agenda, because the context can evolve years after years. So it is something very important. Of course, the heart of the partnership will be to fund joint transnational calls and to organize them in order to support research activity, to boost research. And the third one is something that we have learned during the different crises, and the COVID is not the only one, is that most of the time we are missing some research infrastructure capacities or networks that are not well organized or not at the right level. So it is something that will be, of course, supported within this future partnership. And of course, we have something that will be dedicated to more transversal activities, but that are very important, for example, to tackle all the ethical aspects, etc., etc. And also regulation will be in the scope of the partnership. Thanks a lot.
Thank you so much. Thank you so much, Hervé. And just to say, it is the 2 colleagues in my team, perhaps they're watching us online, who are working with Hervé and the partnership to get it off the ground. And now over to Christian.
Yeah, good morning. So I've been asked to cover a little bit the national perspective, being a researcher from Germany. I have to say first, the European level is the most important level for us as well. Yeah, so we are working in European networks. My group, my institution is on the laboratory side of things. So our current biggest network is the Durable Consortium, organized under the HERA authority of the EU. And then there are the big clinical study structures of the EU as well. For instance, now the name of the structure there is ECRAID. It has had a predecessor organization. We are also trying a little bit to help out with clinical studies on the laboratory end. And this is, so for us, the European level. We have a national level as well. the structure that really existed in Germany well before the pandemic and that afforded a lot of pandemic preparedness nationally is the German Center for Infection Research. DZIF is the German abbreviation, funded by the Ministry of Research. This is one of the research centers, so the so-called Gesundheitsforschungszentren or Zentren für Gesundheit. This structure entertained a lot of the pandemic preparedness we also mobilized during the pandemic. One of this, for instance, is the provision of the first diagnostic test against the new virus when it came along. So we had this diagnostic up and running basically by March across Europe. With the help of another European structure, EVAG, an infrastructure project that provided essential material. Then the DZIF also worked on preclinical and then early clinical phase development of a vaccine that was not approved in the end. This is part of the game, that some of these projects are not successful for technical reasons. But we have an MVA-based vaccine platform that we use for other developments. One is a MERS MVA-based vaccine that's now under CEPI partnership in phase 2. Looks quite successful. And we're looking at further vaccine platforms. We're looking at antivirals. And then one thing I would like to mention for Germany is a new structure that came out already in the early phase of the pandemic, which is the network of university medicine, the so-called NUM. So this is really more on the practical page. It's targeted to healthcare provision by the university medical centers. So it's really a consortium that includes all university medical centers in Germany under the idea to organize the surge capacity in the case of a pandemic, and to provide various functions that are sometimes even indirect linked to the multiple reorganization needs that affect major healthcare providers during a pandemic or epidemic crisis. And that, of course, have their collateral effects then also on the routine medical care provision structures. So this is an important project in Germany.
Thank you.
As an example. Yeah.
As an example. Yeah. I'm ruthless when it comes to timekeeping. Thank you so much. No. So I think what I'm picking up from the various presentations is really the links between national, European, here very clearly from our right side, and the importance of working in partnerships, whether it's between the regions, whether it's between public, academic, and the private sector. And it is my pleasure now to introduce our next speaker, Anna Maria, who is online. And Anna Maria, you'll have 6 minutes because you'll have to answer 2 questions, okay? The first question, like all the predecessors, to introduce your initiative and how it supports research and innovation in epidemic and pandemic preparedness, and also if you could draw on the links between the various other initiatives mentioned here. And the second question is, what are the achievements and challenges in pandemic preparedness research and innovation since COVID-19, because it was a major milestone for many of us. The floor is yours, and you have 6 minutes.
Thank you. So I am the lead of the WHO R&D Blueprint for Epidemics. That is an initiative that came from the World Health Assembly in 2015 in the midst of the West Africa Ebola outbreak and epidemic. And so what we are going to discuss today is part of our work, that is the WHO pathogens prioritization. This is a scientific framework for epidemic and pandemic preparedness, and it promotes and supports research and innovation in several key ways. The first one is that we are taking a comprehensive family approach. Rather than focusing on only some local pathogens that are of importance, we want to promote the focusing on entire pathogen families. And this allows for more generalizable knowledge that can be applied broadly. So to do that, we identify both priority pathogens that pose immediate threats, but also prototype pathogens that can serve as models for developing medical countermeasures against related pathogens in the same family or across families. The second point that we want to emphasize is a collaborative global research effort. And we are proposing that through open collaborative research consortia that we call CORCs, one for each priority pathogen family. And we have one very active, that is the Marburg Consortium, that has now 2 protocols approved for randomized trials of vaccines and therapeutics in Rwanda, and a very vibrant family of experts working together. We also want to outline that the research priorities should be established across the spectrum, from basic science to clinical trials and implementation. And finally, we of course want to build research capacity and infrastructure globally, but especially in the areas at risk. So we advocate for protocols discussions, trial discussions, research discussions in a harmonized way with the regulatory authorities, with the researchers from the countries at risk. And I must say that what we have now is a challenge, because we have an epidemic of initiatives. And this is one of the key issues that needs to be addressed. If we work together, we can align with other initiatives by taking this proactive collaborative approach to pandemic preparedness and research. We want to make emphasis on equitable access and on building the global scientific capacity in the North and in the South. And we think that our comprehensive family-based strategy complements all the ongoing efforts with more targeted efforts on medical contrameasures for a given pathogen or another pathogen. Now moving into what has been achieved. So we know that since the COVID pandemic, there has been a lot of discussions, reviews, reflections, meetings about lessons learned. But there are a few notable achievements that I would like to highlight today. The first one is that we have moved very quickly into an unprecedented rapid vaccine development. It started in COVID for the messenger RNA vaccines, but we also saw it in the Sudan Ebola virus outbreak, where the candidate vaccines were available in 69 days after the declaration of the outbreak. So some are talking about 100 days. Think about 69 days. And one of them, the Chadox from the Oxford University and the Serum Institute of India partnership, started from sharing the seeds on day 0 to 69 days later, having thousands of doses in vials. The second thing that has improved, in our view, to a certain level, but it still requires more, is the global coordination, the global research coordination. We need to continue to facilitate improved coordination between the scientists and the health professionals and the politicians, who have a very important role in outbreaks and can interfere or support as it happens sometimes. We also need to discuss the clinical trial networks. We all want to move to large-scale clinical trial platforms. During COVID, we have thousands of regulatory authorities, funders, and researchers doing boutique trials in Europe, but also across the planet. We need to transform that. And doing a small little networks is not the solution to that. It's thinking big, being interconnected. Increased funding is important. It has been a greater investment in pandemic preparedness, but now investing in early stage work on the basic research, on the translational research across viral families is critical. As we continue to participate in the discussions with our member states, we realize that there are challenges still on equitable access, not to the drugs in the vial, not to the vaccines in the vial, but to the knowledge, to the ability to generate knowledge. That is the main challenge we have in terms of equity. How can we address that? We also have issues regarding diversifying focus. Many people, many donors, researchers are very interested in vaccines, but vaccines are only one of the tools. We also need to have equal investments on diagnostics, on assays, on therapeutics, on monoclonal antibodies, for example. And then finally, there is the issue of the, let's call it regionalism, nationalism. When you look at the pathogens that are the priority pathogens, when we look at the prototype pathogens, when we look at the viral families that can harbor the virus that can cause the next pandemic, most of them have global distribution, wide distribution. They have families like the flavivirus across the continents. We have also the arenaviruses with the Lassa fever focusing on some parts of Africa, but there are the new RNA viruses in the new world, like Hunin viruses that share a lot of the characteristics. Therefore, we are really advocating that work across regions, work across viral families is important. And finally, health system strengthening is critical. And when we talk about capacity building, I would like to invite you to talk about opportunities building. There is a lot of researchers in the South looking for opportunities to use their knowledge and their capacity.
Thank you so much. Thank you so much. And yes, a round of applause. Some very strong statements about epidemic of initiatives. That's a definitely memorable one. And also your point on fragmentation and the need for scale up and thinking big on clinical trial networks. So those are some of the first takeaways. But I will ask the second question, bring it back to our panel here in the room with us. So Shingai, the same question for you. What's your perspective on the achievements and challenges in pandemic preparedness research and innovation since COVID-19? You can stay here, you can use the podium as you prefer.
Thanks very much. So the IPPS and the 100-day mission actually came out of COVID. So I think this is one of the achievements where there was a recognition that some things went right and some things didn't go right. And this is essentially a challenge of trying to say, how can we work better together? We understand that there are multiple people doing multiple things, as Anna Maria alluded to, but how do we bring this together and work towards a very simple and straightforward goal, of course more complex when you look at implementation. So I did show a slide where I mentioned what we called a scorecard. And in January 2024, we introduced this scorecard when we launched our third implementation report. And it quantifies how well prepared we are to meet the 100-day mission. And at the time, we were using data from the 7 priority viral pathogen families. Anna Maria mentioned that the process with the R&D Blueprint has progressed, and there's actually a new prioritization with expanded selection of priority viral families, and we will align with that. But in this initial scorecard that was published, we were able to show that the diagnostics and therapeutics funding was lagging behind that of vaccines. Action is needed to agree on non-human models for testing products. That only COVID and Ebola at the time had a full complement of approved drugs, therapeutics, and vaccines, but not necessarily available to all patients. And that funding was heavily weighted towards COVID-19 and Ebola. So I think that gives you sort of a summary of the assessment when we looked at that snapshot analysis that we're doing. And I think maybe I will stop there. Yeah, I can comment on some of the priority actions that have resulted from that analysis in the next question.
Okay, great. Thank you so much. And perhaps I can ask our show director to bring back the slide with the mission, to bring back Shingai's slide, yes. And we'll come back to Anne-Marie later. So you will have it at the background. No, we cannot do it. Maybe later. Michael Makanga, the same question for you.
Well, thank you very much. Just a couple of things. One is that the COVID-19, one of the very first things that we realized is this increased our appreciation for investing long-term in local expertise. This is a time when all experts left countries, and it is the countries that took ownership. And this is where we saw that the response that was happening in the African region was dependent on African leadership and excellence that had been built over time. And this has led us also to rethink on scale up of this to make sure that we address the different expertise in the region, one of which is, of course, epidemiology, biostatistics, modeling. This is an area that we had piloted with the Africa Centers for Disease Control, and we are now going to bring to scale. The second thing was the value of keeping research going in other areas even before the outbreaks. And this is where we see that the response that we got from sub-Saharan Africa was dependent on countries that had the clinical trial platforms that were adapted to respond to the outbreaks. And investing in that has been key. The other is the rethinking of the designing of clinical trials in situations like this. And this has really created a very dynamic environment that has contributed to WHO leading the way on preparing the clinical trials guidance that was launched last month. And this has really been a major contribution, I should say, and thanks to all the funders that have contributed to this. The other has been looking at the disruption of outbreaks to ongoing work and learning from this. The work that has been most resilient, the clinical research that was better integrated with the health systems. And here the neglected tropical diseases, I have to say, were exceptional in this. Lastly, I want to talk about equitable partnerships and access. This is the learnings from COVID-19 have really increased our appreciation for having equitable research partnerships and paying special attention to access. Thank you.
Thank you so much, Michael. Moving back to Hervé, for your perspective on the achievements and challenges in pandemic preparedness research and innovation since COVID-19.
Thanks a lot. So it's difficult to avoid repeating what our colleagues already mentioned. So I will try maybe to focus a little bit more on other aspects. So I think that, to my point of view, the COVID has been an activator, but probably not the time where we learn the lessons, because it has already been learned before, during Ebola outbreak, but also Zika, etc., etc. So I think the situation was always the same, and the conclusion also. So I think that at the present time, and I will begin with the challenges, I think we clearly need to push to provide more scientific development on basic research to understand what are these pathogens, what are the physiopathology, because most of the time it's always the same story. And I did not forget the beginning of the COVID-19, where nobody knows if we should wear a mask or not. So I think that's probably a first information we shall need, and basic research can provide this kind of information. We have others, of course, examples with the Mpox at the present time, with the nucleid that has emerged in RDC, where there are also some missing information on the physiopathology that is induced by this nucleid. So it is something that is really of main importance. Afterwards, I think another thing that is a challenge, but also probably now a kind of achievement, is that we shall not work in silo. So in the past, the community devoted to the environmental research did not work with the one working on human health, etc. And I think it's something that we have realized we shall try to tackle, and that is on the way at the present time to develop the so-called One Health approach. And maybe the other things is also to push at a more broader scale on the multidisciplinary approach, because we need also to include more, especially with emerging infectious disease, human and social sciences, but also public health research. It is something very important, because it is the research that will help also the decision makers to try to make decisions. Thanks a lot.
Thank you so much, Hervé. Well, the same question for Christian from your perspective.
Yeah, I'm still typing.
Your answer.
No, of course, I have a whole list here that sometimes I update.
You can take the full 3 minutes.
I mean, one thing I accede to is that we have been focusing a lot on vaccinology, and we need actually the diagnostics as the most tractable and most real and most useful output of the pathogens sciences in the field. And with this comes the idea of laboratory capacity. And there is so much laboratory capacity building now, with a focus on broad range surveillance, big sequencing programs. But one thing I would really like to pledge for is to do this with patient benefit in mind. So we need active laboratories of medical microbiology around every sequencer, right? So we are not dropping sequencing machines. We ask what is in it for the patient. And this means we have to establish laboratory teams and functional medical laboratories that are linked to hospitals rather than to public health centers. Even though the data output belongs there, that's clear, but we need to see the patient benefit, and we need to have this in the healthcare provision system nationally. This is really important. Another thing is, I guess in this whole field of research, we need better themes in pandemic preparedness research, because pandemic preparedness research is not a research discipline, right? It starts from our dirty terminology that we use. What is One Health? Why is in every call for proposals and in every proposal, we read the same sentence all over again. We follow a One Health approach. Do we actually know what we mean by this? I would suggest that the misunderstandings about these concepts are really major. Are we speaking disease ecology? Are we speaking veterinary surveillance? Are we speaking cross-border livestock disease management? It's all in it. It's all missing the goal, actually, of what we have in mind when we speak about a One Health approach in pandemic preparedness research. We need to be more precise in our terminology, and we need to make this science. So we have to be aware that, especially during the pandemic preparedness research became opportunistic science in parts. And we have to move away from this. We can't do opportunistic science because it's not science. So we need to define first whether we want to do fundamental research or applied research, and then turn to those, let's say, funding parties, to the political counterparts behind this, and ask what actually can be done. Tell them what can be done, what questions can be asked and answered, and what questions can never be answered, because this is part of the problem. Complexity. We will never be able to detect the next pandemic agent before it leaves the reservoir. The complexity is just too big. We can never assess the biodiversity that is in reservoirs and thereby predict by some undefined way, we don't even have a conceptual definition of this, where the next pandemic will come from. It's just impossible. We should stop making these promises from the scientific background, right? And then another thing that somehow leads from this idea is credibility of science, and this links to politics. So politics are always stronger than science, and this whole theme of misleading the public, misleading politics, spreading disinformation, and standing up against disinformation, redefining or defining actually what the pandemic was, what happened, just to look back on the history and say it did not all happen at the same time. Something came first, another thing came then, and then this is how we ended. To really make clear how this pandemic went and to draw the lessons from those facts rather than from beliefs is very important, and we should in science be part of this endeavor. It's really important that this is not left to the political sphere entirely.
Thank you so much, Christine. And I think it's a very nice segue to actually our next question, because I'm not a politician, I'm a policymaker from the EU level. I can see some colleagues also from the EU level institutions, but also from national administration. So my question is, building on what we have heard about what we have achieved, where the gaps are, what are our challenges, what would you say should be priority actions? So you can address the global level, you can address European or national level, or perhaps specific communities that transcend those different geographical groupings. So I'll start with my neighbor here, Shingai. What are the priority actions that you see from your perspective?
Okay, so from the IPPS, our priority actions for 2024 were following the launch of a diagnostics framework in 2023, identifying funding that can support the development and implementation of this diagnostics framework. The therapeutics pipeline enhancement, following the assessment that was indicating that there was a lack of funding invested in therapeutics. Then supporting regulatory alignment and preparatory regulatory approaches, as well as sustain and strengthen regional and global clinical trial infrastructure. And just zoning in, for example, and focusing more on therapeutics, realizing that there are different players that are working in the area of therapeutics, but no one really at the global level that was focused on the development of therapeutics for pathogens with pandemic potential. And so IPPS is working together with many partners who many of you know, including READY, DNDI, Intrepid, IFPMA, to try and see whether they can come together to form a coalition that can focus on initially looking at developing candidates for priority pathogen families that have been identified for pandemic potential. And it's really just trying to enhance how people can work together. And this therapeutics roadmap has been developed and it has been published, and the intercollaborative team of these different organizations has begun work. So yeah, I'll stop there.
Thank you so much.
Yeah.
Michael, the same question, priority actions.
Thank you. Starting with research and development, it's really continuing to focus on addressing the underserved populations to make sure that we implement and promote clinical development of medical interventions that will pay attention to the underserved populations so that they're not left behind. And this, of course, is more on the side of late-stage clinical trials, although we are supporting all of them. Secondly, to make sure that we make use of the ongoing research, and in that case, strengthen the clinical trial platforms, which can be adapted to address different areas, and also to support cross disease and interdisciplinary areas, like, for example, genomic surveillance or other areas that are cross-disease that will be able to serve different areas and can be used in the clinical trials ecosystem. Thirdly, to pay attention to the capacity in the countries where we are working, the people, the infrastructure, and the systems. And in terms of approach, to really strengthen the cooperation and partnership between the public and the private sector in order to deliver our work. And lastly, increased interaction with the ethicists and regulators, making sure that this area is also addressed. Over.
Thank you very much. Moving to the right of the room, Hervé.
Thanks a lot. So it will be quick because Michael killed all my comments. But anyway, no, I think I can move. So I think something that is one of the priority concerns more or less what we could call the coordination. Because we know that in many countries, the amounts of money and the capacities is not there to provide a clear development of future countermeasures. So I think something that is of main importance and that is on the way also within the partnership in Europe is to align research, to agree on common priorities where the effort will be provided to boost the research with a common agreement among all the countries. I think that's something that is more or less key. And maybe to focus on another aspect concerning the flow of development of countermeasures, because what the population expects is to have countermeasures available, diagnostic, preventive means, and also therapeutic means. So I think something that is missing at the present time in terms of research flow development is what concerns the preclinical states and the first clinical stage, because most of the time the scientists in the labs never know exactly how to perform a clear preclinical assessment of proof of concept that could be moved to the private sectors. They have to learn or to develop specific processes, and most of the time is not there. And also to be in position to have access to some specific batch of countermeasures adapted for preclinical tests, but also adapted for phase 1 clinical trials to attest the pharmacokinetics and also the safety. So I think it is something that has to be supported at the present time, that is not going on. And the last point probably is also to make more close the clinical research and the basic research. I think there are lots of potential within the cohort's studies, for example, but not only for the clinical trials, that could be taken into account where there could be an added value for the basic research. So to go from the beds back to the lab, that would be my work there. Thank you.
Thank you very much. And we'll have question round soon, so I hope you're thinking about questions. I would love to hear about this alignment of research priorities, how easy or difficult it is in practice. Christian, for you, the same question on the priorities.
Yeah, well, I have already commented on my list of priorities, basically, and I agree very much with Hervé. Coordination is actually one thing we have on the agenda. As Maria said, we have this epidemic of initiatives currently, and we all wonder how long this is going to last and what will remain if really we go through a period of parallel action in many countries on many levels. That may be a bit short-sighted, right? So we need coordination mainly to achieve long-lasting effects, also to achieve effects that go much beyond the pandemic. So we shouldn't burn the energy that was created through the pandemic, but actually use it to create something in addition, right? So to create something that's more long-lasting. And I can only repeat that is for the patient benefit, especially in global south countries. We need to have a lasting effect on patient benefit. Otherwise, we will not be able to make really the case for long-lasting local investments that are stimulated and promoted in countries of the global south. Otherwise, we are quite lost on the argument there.
Thank you very much. And our online speaker to come last with her answer to this question for priority action.
I think we have 3 levels of priority actions. One is the political level. This is where WHO is working with the member states on the discussion of the pandemic instrument. We think this is a key initiative aimed to strengthening global pandemic preparedness and response. This proposed legally binding agreement seeks to address the gaps that were observed during the pandemic and to create a more coordinated, equitable global system. There are challenges to this, and they're publicly discussed, but we really need to all put the same effort in ensuring that we have that, because that instrument will represent the needs and the desires of the 194 member states of WHO. So that's the political. Now, in the coordination part, I repeat, we are proposing, and I have learned from working with many scientists like those on the table today, that science progress with freedom and with support and with diversity. But also we have learned that having global research and development roadmaps that agrees on what we aim to achieve will be very important. They are important not only to give the signal of, okay, this is the direction we want to go as a community, but also this is, are we making progress or no, which areas are not covered? And I just want to say, I think we make statements when we get into a field saying, no, nobody's working on this. And this is why I came here. But if you look carefully, some of these statements are not perhaps correct. So I think we need to have this open collaboration consortium, and WHO is moving forward. And I'm here thanking 12 of the largest research centers in the world who have already agreed to be WHO collaborating centers, each of them hosting the platform for one viral family. So you will be all invited, because one key thing of this concept is that it's going to be open consortium, open to everybody, open for the discussion, open for the collaboration, for the exchange of knowledge. And the third point is the point of what happens during outbreaks. So I am myself an epidemiologist and a clinical trialist. So I think doing clinical trials is wonderful, and the better the clinical trials are, the best. But I want to say 3 things. First, clinical trials bring into the South have the problem of you are bringing already a product that was developed elsewhere. And what the South wants is equity in the access to the knowledge, equity in their ability to generate the knowledge. So as Christian Drosten was saying, if we do not work on the basic science, on developing the diagnostics, on improving the smart surveillance to monitor these pathogens, all the other things we will do will be not very fruitful. Number two, we need science also to learn how to develop medical countermeasures. Most people think that the solution is to put vials of certain vaccines for certain pathogens in bottles and have them ready. That may help us for a handful of outbreaks, but since there are 1,800 viruses and bacteria that can infect humans and can be modified with changes in the context and cause the next pandemic, are we going to have bottles, little bottles of vaccines and therapeutics for 1,800 viruses? And how we are going to maintain these stockpiles? So we need to be clever in the way we develop these medical countermeasures. That's our emphasis on prototype and priority vaccines. And finally, yes, clinical trials, yes. But most of these trials, I'm an old woman now, so I have been in many outbreaks. Most of these trials occur in places where the nice white elephants with the research label outside the door are not located. Most of the trials are done in the field with the local, integrated with the outbreak response, with the local people, with the local doctors, with the local epidemiologists. So yes, we need to build infrastructure for clinical trials in general, but we have to address the issue of trials for epidemics, fakes, and pandemics in a very different way, because so far, all the trials that have succeeded in this context have used a different model to the standard model being discussed through networks.
Thank you so much, Ana Maria. Wow. I'd like us to give applause to all the speakers. Firstly, for their really insightful comments, and secondly, for keeping to the time, so to give you time to ask questions. Okay, so can I ask you to raise hand if you would like to take the floor, ask question, or make a comment? And when you do so, please introduce yourself, the organization that you represent, and ideally, if you have a question, and there's a lady here, yes, raising her hand, and then at the back, if you could specify to which of the presenters your question is directed, okay? So we'll take a set of 3 questions, and we'll kick off like that.
Okay, thanks very much. Thanks for the honour of asking the first question to what's been a fantastic panel. My name is Val Snewen. I'm with the Department of Health and Social Care in the UK, which is the Ministry of Health in the UK. So a few people have mentioned the kind of outbreak of initiatives, and I'd like to just raise, it's maybe more of a comment, the role of the research funders, the funding agencies who fund the research. And I just wanted to flag that members of the GloPID-R coordination mechanism are here in the room, and note that with thanks to the European Commission and Charité, Christian Drosten's organisation, for hosting the Secretariat of this GloPID-R organisation, which brings the funders together, funders with an interest in pandemic preparedness research. And thanks to Ana Maria, who's hosting the next meeting of the GloPID-R General Assembly at WHO in December. So I really just wanted to flag that. Don't hold back really on bringing the research funders into this discussion, and bringing us together through this GloPID-R initiative to ask us these questions really, because a lot of the funders I've worked in, funding agencies over time, we really want to coordinate, and we really try to coordinate. And we fund EDCTP, we fund CEPI, we fund the big trials that are going on in your region doing capacity strengthening. And so fundamentally, to bring that arm into this discussion, I'd say we could make more of that really. And I'd just like to say thanks very much to the GloPID-R group for the work that you're doing. Thanks.
I think there was a question here in the second row, lady in the second row.
Hi, my name is Ashley. I'm an Erasmus Mundus master's student in infectious diseases and One Health. And my question to the panel is, we spoke about keeping pandemic preparedness high on the political agenda. And my question is, how can we also keep it high on the public agenda? How can we communicate our research into pandemic preparedness and response to the public to help them be ready to act, to detect and respond to pandemics without creating so much fear and anxiety that can be counterproductive, I think.
Okay, great. Good question. And the third one, if there is... No, okay. I think the question from you, Val, was more of a comment. Let's not forget about the funders, and also from the perspective of the European Commission, of course, we are the funder and use the networks like GloPID-R and other research funder networks to help us align those agendas and agree on the priorities. So that is also very important. And also we are very happy to have our UK friends back with us working on the horizon. So that's also very welcome news. Okay, the question here from the lady from Erasmus Mundus, again, a great European Union flagship project. I should be paid for this kind of EU plugins. Another great European action, just like Horizon Europe. Not UK, not yet part of it. Again, part of it. But more about this communication to the public. Yes, that was your point. You have not asked any of our panelists in particular to take the floor. So maybe I'll ask for the for any volunteers between the panelists. If somebody would like to go first, Shingai, there you go.
Thanks very much. I think it's a very important question, and I think we will probably all say similar comments. But depending on what work you're doing, it's of course important to think about how that translates to the community. And working alongside civil society organizations, whether you're looking at developing drugs or vaccines, whether you're looking at clinical trials, you must always have a component of your work that is looking at how you engage the communities, how you translate the scientific information or outputs of the work that you're doing into messages that are acceptable and understood by the communities in which you work. And I think you raise an important point that it shouldn't be sort of on and off only when you have an emergency. So you flood the public with so many messages at the time of the emergency, and then when it comes down, there's absolutely nothing. So that continuous engagement and enriching the knowledge and understanding of the public needs to happen more. And I go back to Val and the funders to say, when you are issuing grants, please be mindful of the community engagement components, and please make sure that this is not the element that gets cut off when you're dealing with a tight budget, because usually that's the case. The first thing that gets cut off is going to be the component of community engagement and what happens post the end of the trial. Do you go back to people to tell them what happened to that drug, the diagnostic, the vaccine that you were testing? Where has it gone? Has it been manufactured? All of that requires time and money and people, and usually those resources are not there. So I'll stop there. Thank you.
Thank you so much. Anna Maria, I heard you would like to take the floor. Sorry, because the navigation in the room is not always easy, but yes, that's correct. You would like to take the floor.
So I have 3 points. One point, Christian Drosten made it more elegant than I will now, but it's the issue about honesty and transparency in the way we communicate what we know and what we don't know, and the uncertainty. And this is our challenge with the public. How we communicate uncertainty, because uncertainty is critical to scientific development. Number 2 is the question of how we invest on research to resolve some short-term problems now, like the priority pathogens that we know, and present that as a program to prepare for the future, but not in blah, 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 but in reality, how we work on that. And number 3, I think it is very important that in this pandemic of initiatives, we do not come out saying, wow, I organized my initiative because nobody was doing anything in this area, and that is a disaster. Because the public hear that, and the accumulation of initiatives justifying that there is nothing happening permeates. When I go to dinner parties with my friends, they tell me, wow, there is this new initiative because nothing was happening, and we are in deep trouble without them, we cannot save the planet. So we need to also find a way to promote our scientific knowledge, as Christian was saying, without the necessity of making all this expansion of and use of all these superlatives in English to justify our investment. And before I go, I have to thank EU HERA, because everything we are doing on the filovirus family, preparing for Marburg, Sudan Ebola, and Ebola, is very much the support of EU HERA and the Canadian government. Thank you.
Great, thank you so much. Coming back to the question about communication to the public, Christian, may I draw on your expertise? Something tells me you have a bit of an experience in that field, so maybe you would like to share some further thoughts on that.
Yeah, well, it depends a bit on which layer you are arguing, right? So, for instance, a thing like community engagement that you were referring to is a concept we don't have in Germany. We have social media, right? That's already one of the things to begin with. So honest messaging, right? What I believe in very much is there is no way to hide yourself in a silo, not communicating. I think as scientists, we have to communicate. We have to openly communicate. We have to say what we know, what we don't know. It's these old ideas, these old concepts that are repeated all over again. But if we look at communication, how it happens, some of these things are not really complied with, right? So it's difficult to really convey a pure scientific message, to not mix politics within it, to not mix your private attitudes with this, to stick to your area of expertise. That's one of the most important things for communicating scientists, to say, well, this is something I don't really know anything about, but that doesn't mean it doesn't exist. There are other people you can ask. This is a difficult thing to say for many scientists once they are in contact with journalists. It's really not easy to resist this temptation to be public about things that you actually don't know anything about. So this is the simple truth for scientists. And then, of course, there is a whole different sphere, which is journalism and the media. This is much more difficult. I'm actually not an expert in this, but we have to somehow be aware of the fact that our whole perception of reality is through the media. We are not perceiving anything else except maybe our dogs or our kids, but everything else goes through the media. And so this means we are not getting a pure distilled version of reality. We have to consider several sources, and well, we have to be careful about intentions behind the representation of reality that reach us. These are very general perceptions that we are often not aware of, and we often don't really make clear to ourselves that we are a private person on the one hand and a scientist on the other hand, and we should be in public only because we are scientists. Nobody elected us. We have no mandate to speak as a politician in a political function. We should just keep quiet about this and just be a scientist in public.
Thank you so much. Oh, there are more questions. Yes. So let me do another plug-in, and I come back to you in front. So as you may know, the European Commission is changing a mandate, or there is a change of mandate at the EU level. We have new commissioners coming in, and the commissioner designate in our area of responsibility in research and innovation has been mandated to develop so-called life science strategy for the second quarter of next year. And one of the important dimensions of that strategy, we would like to make addressing disinformation and misinformation about science, and precisely that important point about communicating science in a way that is accessible, and to address also the misinformation aspect. So if you have brilliant ideas for what can be done at the EU level, we are takers. I'm sure there will be a call for evidence and structured way of communication and possibilities for input. But just to put it out there, what can we do at the European level to really respond to that big issue? Okay, two questions at the front, gentleman and the lady.
Okay, thank you so much. My name is Tanaka. I'm from Zimbabwe, but I'm an Erasmus Mundus student studying infectious diseases and One Health. So my question goes to the policies and the preparedness of pandemics. Are there policies that are in place right now to ensure that there is equitable and equal distribution of vaccines all over the world? Because I've seen in the pandemic, especially the COVID-19 pandemic, there was not an equitable distribution of vaccine, especially in the underserved populations. What is being done right now? Thank you.
Is your question directed to any specific panel member?
I think Shingai.
Yeah, so I think
We'll-
Anna Maria
we'll-
actually mentioned it, so she can actually respond the pandemic agreement. But yeah.
Okay, so I'll take one more from the lady here, and then we will come back to the answers. Are there any more raised hands? I like to take them in sets of threes. So, no.
Cassia needs a third hand. Can someone raise their hand?
Thank you. Nobody.
Hi, thank you so much. My name is Jannika Schmidt. I work at the Institute for Progress, a think tank in Washington, D.C., and I am also an aspiring medical doctor here at Charité. I thought this was really, really interesting. Thank you so much. I have a question on something we didn't specifically talk about, because we mentioned a lot about vaccines, therapeutics, diagnostics, but there's also, of course, personal protective equipment. And I think this is something we saw during COVID. We had a lack of it. It didn't fit perfectly. Our stockpiles weren't in order. So I have a question on whoever wants to say something on this. What do we need to do internationally to be better prepared during the next pandemic? I know that HERA is doing fantastic work on this, and it's doing great work on stockpiling. Yeah, but I'm curious about the broader international context.
Okay, great. So let's start with the vaccine distribution. I don't, Anna Marie, would you like to take this or come back to the treaty? Yes.
So I just want to say, let's talk about what we already have. That was the question. And so during the World Health Assembly in May, the international health regulations revisions and amendments were approved. And I'm very pleased to see that this is an instrument for the reporting of events, infectious disease outbreaks, etc. And for those of you who are not familiar with the international health regulations, it's a legally binding instrument, and it includes already clauses about health products, including medical countermeasures that have importance in the context of outbreaks, fakes, and pandemics. So that's the first thing. But the core of the discussions on the equitable access to medical countermeasures, including PPEs and diagnostics and etc., is in the deliberations of the so-called pandemic treaty or pandemic instrument that is going on now. And as those of you who are familiar with, the member states agree to continue the deliberations until the end of this year, maximum until the next World Health Assembly in May. And I have been part of many of the deliberations, and I can tell you that the main plea from the countries in the so-called Global South is to find a mechanism that ensures that if there is going to be another outbreak, fake, or pandemic in which the amount of medical countermeasures is finite and limited, that the distribution and the access occurs in an equitable and fair way in order to address the needs of controlling this event. But in another hand, we are insisting, and this is part of my team's and Dr. Ryan's, my boss, personal plea, is that the best way in the long term, the most sustainable way to ensure equity in access to medical countermeasures is to build this capacity to generate knowledge from the smart surveillance, the basic research, the translational research, the product development to the clinical trials. That just bringing products and organizing clinical trial networks and say, I developed this and I want to test it in your community, be a good clinical trialist and do a good trial for me, is not the solution. That the solution is a comprehensive approach to transform the way knowledge is generated and shared. And this is why I want to bring back this idea that opening equalitarian open, transparent discussions on the research for the viral families, on the abilities to develop prototype and priority medical countermeasures for priority pathogens is critical. And if we failed on this, if we fail to ensure equity, whatever other great discoveries we make will not be sufficient to cover our failure. That's really the quid of the discussion. And as Dr. Tedros constantly says, you can do whatever, but nobody is safe until we are all safe. And this is only achieved through equity. Thank you.
Thank you very much. Michael, would you like to respond to this question or comment on any previous comments?
Thank you very much. I just would like to comment on the question on the personal protective equipment, because this is something that we pay special attention to. I mentioned that much as we support research on other diseases, in situations of outbreak, we encourage the clinical trial platforms to respond when necessary. And in this case, frontline workers are really exposed. And this is, special attention is paid to ensure that they are protected. And it's not just a once-off protection, but ensuring that they have a good supply of equipment. And to think ahead, especially when these are anticipated, to ensure that they have adequate supply of clinical trials equipment. We saw a lot of this challenge during the COVID-19, because this is part of the adaptation that the different studies or consortia had to make. So thank you for raising that.
Thank you. Shingai.
Yeah, so to respond to the second question, so I think one of the topics that's being discussed quite openly in global health is the term local manufacturing, and I think you've heard it in the general discourse. And I think it's really important because it's looking at the dependence that generally developing countries have had on importing different components, medical countermeasures, general medicines, generally everything from the global north or from the east. And it's really to look at how do you systematically build the capacity for local production. After COVID, everyone wanted to manufacture vaccines. In reality, not everyone can manufacture vaccines. It's complicated. You don't just need the technical know-how. You need the market. You need, there's many complex elements that you need to factor in to manufacture vaccines. So you do need to bring the capacities to the countries. When we were faced with challenges in COVID, but I think other pandemics as well, we were stuck. We had no masks, we had no sanitizers. And during that period, there was quite a lot of innovation and a lot of local manufacturing actually resulted. But unfortunately, many of those people who were able to produce medical countermeasures, basic things in COVID, because of lack of market and sustainability, they have all died down. So you probably find that we're back to importing again, things that we actually had built the capacity to develop. So I think it's a systemic change that's required to build the local capacity, that's the technical ability, but also to bring the market components that allows those different products to be developed at local level, but to be bought.
Thank you very much. Hervé.
Yeah, just maybe one short word on the first question, because I think that sharing and access to countermeasures is also an issue of research, because I really believe that you have also to include in your research vision the compliance of your countermeasures you want to develop with the environmental conditions. I think it's something of main importance to develop products that have to be maintained at minus 70 degrees in tropical forests. I think it's a dream. That's what I would say. It would be the same in many other countries with the environmental conditions. So I think it's a research criteria that has to be involved also in the way we want to manage this. Otherwise, going back to the protective means, of course, I've been heading during 17 years the BSL-4 lab in France. So I'm quite convinced that it is of main importance. And of course, it has to be considered in the category of research that would be supported between diagnosis maybe and therapeutics means. But of course, and it could be included in preventive means, by the way. So it is something that could be done. But that's another story, because you have to have on board what I've mentioned, also a kind of multidisciplinary approach. Because most of the people that perform research in this field are not closely related to the human health research. So, but it is something that is feasible. I know some centers where they can provide this kind of help, because the engineers are also researchers that can try to propose this kind of research.
Thank you. Christian, any comment from you?
No, I think I shouldn't add to this.
Okay. Great. I actually wanted to come back to your comment on stockpiling and maybe draw to bring a story from my former life to show how COVID helped us actually in greater preparedness, and that's really around stockpiling. In my previous role, I worked as an advisor for Commissioner for Humanitarian Affairs, and there he oversaw the European Civil Protection Mechanism. It is a mechanism that had, until COVID, been primarily used to help firefighters put down fires in another member state. So Polish firefighters going to Sweden, or the Spanish going to Greece, and so on. And it helped us also, it helped us to realize that we needed kind of a European level a safety net for this kind of very traditional civil protection response. But came COVID, and we saw that actually, that network of solidarity, EU level solidarity, should be extended beyond the earthquakes, beyond fires, beyond floods, and also cover medical emergencies. And that was well before Hera was born. And in that heat of the moment, we realized that we needed the European level stockpiles that the member states of the EU can call on and get personal protective equipment, get some also other measures related to CBRN countermeasures, but also that third countries from outside of Europe can ask for in terms of to have access to in cases of emergency and for duly justified cases. Sometimes it was used, one concrete case, it was used in a response to COVID outbreak in India that overwhelmed Indian healthcare system, and then also was used for vaccines sharing, for example. Bilaterally between EU member states and third countries. So with COVID came development of that instrument to something that I'm happy to hear is being well recognized. I'll just check. Yes, there is one hand. And this is your last opportunity to ask questions. So if you have question that is kind of lingering, it's now or never.
Thanks. My name is Tejas. I'm from India, and I represent a vaccine manufacturing company. We've talked a lot about developing science and pandemic preparedness. A major hurdle to bring products to the patients are regulatory approvals and regulatory guidance. I wanted to know if there are any initiatives to expedite or harmonize regulatory guidelines to, in terms of pandemic preparedness.
Okay. I will not ask every single panel member to respond. I'll just ask if there's anybody on the panel who would like to take that question. I see it's Anna-Marie.
Yes. So my colleagues in the regulatory department have been working for many years on two areas. One is to improve the capacity, the ability of a regulatory authority to be able to review and give authorization or no objection for the conduct of clinical trials and for the authorization for the commercial use of different products. And this is something ongoing, and there are several regulatory authorities around the world today, you can find in our website, that comply with these international standards. The second part of the work is what is called regulatory convergence. And this was very, very helpful, particularly during COVID. Of course, it's an area of work of expansion, but it has made tremendous progress in the sense that the regulatory science discussions are joined with the regulatory issues, and regulators have debates in bilateral, but also in groups like the ICMRA, where they debate what are for example, the standards of evaluation of COVID vaccines, or how they are going to look at immunobridging and consider that. And that has been very useful. And then finally, there are networks of regulators, particularly in the South, like the ABAREF in the African Union, in the African continent, the African region, but also in the Americas regions, there is a network supported by our colleagues at the PAHO office that collaborate. So there is going on work going, but I just want to say that from the scientific point of view, what we are trying to do is to push the conversation, force the dialogue, to adjust the current guidelines, the current requirements, the current paperwork, solicitations, as the science and the knowledge move forward. And just for Hervé, there are Artex. It's a device that exists since I was involved in Ebola trials in 2015 that can keep vaccines or anything at -80 without electricity. You can take it to the field and you don't have to refill it or put it in the fridge again for 10 days and maintains -80 degrees temperature. And I'm using this example just to say that science has progressed so much that now democracy in science is possible, that the technological advances allow us to transfer that to all the corners of the world. And finally, just want to say we do not need to have a factory of vaccines in every country, or every country producing PPE, or every country producing the therapeutics. We just need the collaboration and the framework and the agreement that it will be equitably shared. And because the issue is sustainability. You build a factory for vaccines today, what are they going to produce? Unless they produce vaccines that are needed every day, the factory will not be maintained. And we did that with flu, and it failed. There were about 6 different projects funded by the US government and WHO around the world for epidemic flu. And because there was not enough demand for seasonal flu, many of these projects, after a few years, closed down. Thank you.
Thank you very much. I think we are reaching the end of our session. And before closing, allow me one comment. Actually, majority of questions, if I calculated well, came from students, doctors in training, scientists in training. And I think it's a great testament to the role you, as my great panel here, are playing as role models and leaders to draw the next generation of researchers in epidemiology, in global health, to follow your tracks. So continue your good work and continue your leadership role, because this is super important as well. So with that, I'd like everybody to please thank our panel with a great round of applause. Thank you very much.